Good afternoon, everyone. Thank you for joining us for today's Cardiac College session. My name is Paul O. I'm the medical director in the cardiac rehab program at the University Health Network. It's my pleasure to welcome you to today's session that will provide an update on coronavirus. We've been doing these periodically through the Cardiac College online sessions, and we thought that it's been about a month since our last update, and there have been some interesting new developments for June that we thought would be worth spending a bit of time on. The specific agenda or the ground rules, of course, for all of these sessions that hopefully they are educational in nature. If you do have some questions about coronavirus or your own heart health, then we would ask you to connect in with your healthcare provider about that. And please, I'd welcome you to use the Q&A part of the Zoom functions to ask your questions, and we'll look forward to a lively Q&A by the end of this. Over the next 30 minutes or so, here are some of the topics that we would like to cover, including new treatment studies. Is there anything new that's looking promising in the management of COVID-19? Now that the hot weather is with us firmly, are there some considerations for the summer months? And we'll talk about a couple of key sorts of issues of interest. Lots of discussions in media about masks. Where are we at masks within Canada, within the American kind of guidances, and what's good or bad about them? A bit of information about exercising safely and what we've been learning from different studies. And then finally, some information about vaccines. I hope you'll agree with me that these are all very relevant topics and are very apropos given developments in media and in science. So let me go back, and we're going to touch on a couple of these World Health Organization myths and facts. If you go to the Mythbusters section of the WHO, then you'll find these nice infographics. When we talked about this last month, we kind of presented this as a guiding slide. And indeed, this one was produced on the 27th of April. So gosh, that seems like ages ago in the world of COVID. And it said that while several drug trials were ongoing, there's currently no proof that hydroxychloroquine in particular or any other drug can cure or prevent COVID-19. And it called out particularly issues around that medication called hydroxychloroquine being potentially hazardous, causing serious side effects and illness. And indeed, over these last couple of months, we've seen further information about the potential hazards of hydroxychloroquine, notwithstanding some high-profile endorsements of the product. Subsequent studies have either failed to demonstrate any benefit or have actually been concerned about side effects, in particular heart side effects related to the medication. And of course, hydroxychloroquine has a proven use for people with inflammation conditions like arthritis or conditions like lupus. So there was a real concern that people were stockpiling hydroxychloroquine at the detriment of people that really needed them. Hopefully people can actually return those supplies back into the environment so that people in need of hydroxychloroquine can use them for reasons that are important, and we can get away from thinking about this as a management therapy for COVID-19. Last month, we also talked about a breakthrough of sorts, small breakthrough, and that as opposed to hydroxychloroquine, which theoretically has some action against viruses, there were some specific medications that were designed to treat viruses by interrupting how they reproduce and grow in human bodies. And this drug called remdesivir we talked about last time. And in this one study from the United States of about 1,000 people, the use of remdesivir for people who were actually hospitalized with pneumonia and COVID-19, well, it was shown that these people did recover somewhat faster than people who received placebo. But it wasn't a magnificent breakthrough because people who didn't receive the drug also did reasonably well within this study. So what's new? In the last couple of weeks, there was news about this medication called dexamethasone. And when the study was actually released in the media, in my email news feed from Medscape, this trial was discussed and, quote, hailed as a breakthrough in COVID-19 because it theoretically had an impact on death. Now, it's interesting how rapidly information moves and studies get conducted in this timeframe of COVID-19. And as recently as February of 2020, so that was just 5 months ago, in the very prestigious British journal called The Lancet, they ran an article in that journal saying, well, you know what? The clinical evidence does not support corticosteroid treatment for COVID-19 lung injury. And what corticosteroids refer to are a family of medications, including that one called dexamethasone. So this article in a very prominent journal said, don't use drugs like dexamethasone for lung injury. And what they pointed out in that article is that if one looked at, in this case, 4 previous studies of COVID-19, as well as other studies from another coronavirus that was noted from the Middle East, that's MERS-CoV, as well as other kinds of viruses that can attack the lung, like influenza in adults, or RSV in kids, the bottom line was that if you gave these sorts of populations steroid therapy, like dexamethasone, what was observed in small initial studies was that, in fact, the infections may actually be worse. And there might be complications associated with that steroid therapy. And in one study of influenza, in fact, it seemed that more people actually died from their infection. So that led to the proclamation back in February that you probably shouldn't use these kinds of medications. And in fact, they might be worse. Well, what have we learned through the months of March and April and May? Well, one thing is that a characteristic of COVID-19 infections on the human body is that it causes not only infection with virus, but the body's reaction to the virus is a very intense inflammation that goes throughout the body. So when our bodies are trying to fight and react to the virus, they can turn on very angry reactions. It's like there's a war that's waging inside the body. And parts of the damage that might actually occur inside the body to the lungs, as well as other organs, result not so much from the infection per se, but it's our own body's reaction or even overreaction to the virus. So the notion of giving steroid therapies like dexamethasone that can actually calm down that reaction to some extent, the idea has actually become relevant again. And so very interestingly then, in June 2020, so this is just a couple of weeks ago, this group from the University of Oxford reported on their findings from a study that they called Recovery, a randomized evaluation of COVID-19 therapy. And their headline that was picked up by news media as well as medical media said that low-cost dexamethasone, this is not a new drug, it's a very old one that we use for all kinds of inflammation conditions, reduces death by up to 1/3 in hospitalized patients with severe respiratory complications of COVID-19. So this actually went directly opposite to that article that was published in the Lancet journal only 3 months previously. So what did they find? In March 2020, so even after that article was published, people were thinking, you know what, we're seeing tremendous inflammation, so we better do this study in a very thoughtful, careful way. And that's the way science needs to be done. Not because of ideas from just some preliminary observations, but actually to conduct the really good experiments. And that's what's something that's been taught to us over and over again during this period of COVID-19. recovery study was established to test a range of potential treatments for COVID-19, including low-dose dexamethasone. So why is that important, low dose? So you give enough to block the inflammation, but not too much that you cause side effects from the drug in people that might be quite ill. You need to do fairly large studies so you can pick up when there's going to be problems. So in this study, there were over 11,000 patients enrolled from over 175 hospitals in the United Kingdom. And within a couple of months, the team that was looking carefully at what was going on with the study looked at what was happening with the people that were treated with dexamethasone. And they said, you know what? We've seen enough of an effect to say this drug was actually working very well. And that happened when 2,100 patients were randomized to receive the dexamethasone injection compared to 4,300 people that did not receive the dexamethasone injection. And this is a once daily, injection or a pill that people took for 10 days. So first of all, what was going on in the people that did not receive the medication and just receiving usual care, which would be, we'll give you some fluids, we'll give you oxygen in the intensive care unit, we'll give you any other medications that you might need for fever, fluids, pain relief. What they observed over a 1 month period of time for people who are in hospital with severe coronavirus infections was that unfortunately some bad things happened, including people dying. And for those people who were sick enough to become needing intensive care unit and requiring a machine to help them breathe, that's ventilation, gosh, 40% of these people actually died under those sorts of usual but excellent care conditions. For people that didn't need the ventilator machine but just needed oxygen, either by a face mask or prongs that would give you oxygen up the nose, well, about 25% of those people would have died at about 28 days. And for other people that were not quite as sick but still needed to be in hospital to receive care, about 13% of those people died in the study. Okay, so we've got these numbers. If you're in the ICU on machine, death rates are high. If you're in the hospital on oxygen, death rates are kind of in the middle. And if you're in the hospital because you're too sick to be at home, then the death rates are going to be somewhat lower. But all of these populations, gosh, they had a rough time of it. Well, what happened to the 2,000 people that actually received dexamethasone? Well, for those people that were actually on the ventilator machine, simply taking a little bit of dexamethasone, again, by injection or by pill once a day, reduced the number of deaths by 1/3 in the ventilated patients. For those people that were in hospital and receiving oxygen, the death rates were reduced by 1/5. And these things were quite remarkable because these people are very sick on the machines or receiving oxygen. And what the authors concluded when they went through the calculations, they said, if you had 8 people in your ICU on a ventilator machine and you gave them the dexamethasone, you would be able to prevent 1 death. And in clinical medicine, these are quite remarkable outcomes, especially when the medication is very simple to give, it's readily available, and it's so inexpensive. This was then, the reason for all this was that this was then hailed as the breakthrough because this was a simple way of helping people out in a huge way with a very simple intervention. So that was one major advance. There are hundreds of other studies underway looking at other therapies, but this was the exciting breakthrough for the month of June. And speaking of June, we've now entered into the summer months. Lots of excitement of things going on associated with the summer. The province is opening up a little bit. People are heading up north to cottages, getting out into parks, maybe even onto the beaches at the waterfront. So how does summer interact with our safety? Well, we talked about this last month, and I thought it was worth bringing up. I've gotten a number of mosquito bites from being outside, and I can just wonder, are mosquitoes giving me coronavirus? And again, just to remind us that the World Health Organization looked at this carefully, and they said, to date, there's no information or evidence to suggest that coronavirus could be transmitted by mosquitoes. There are some terrible diseases that mosquitoes can give us, including malaria and different kinds of viral infections. But they've reminded us that the new coronavirus, COVID-19, is a respiratory virus which spreads through droplets when infected people cough or sneeze or breathe on you from extended and close exposures. So don't worry about those mosquitoes for coronavirus. Protect yourself from mosquitoes for other reasons. When we think about also the summer and the heat and warm climates, again, we were looking at issues about, is there any protection from the heat, or will the summer make coronavirus go away? And while emotionally, I guess some of us were hopeful for this, wondering that, things like influenza tend to go away during the summer once we get through the cold and flu seasons. Well, these data are kind of sobering, aren't they? And this is a screenshot from the Johns Hopkins University dashboard of COVID activities. And in the middle is this global map of where COVID-19 has been rampaging through populations. They point out that there's over 10 million cases confirmed around the world at this point, and over 500,000 deaths. And if anything, what's interesting is that it appears that the line of where COVID activity actually happens, of course, is around the equator. And it's on either side of the equator. So it didn't matter whether you had your winter first and then summer second, or summer first and then winter second through coronavirus. It's really just all spreading. And I think it's really a question of not if it's going to happen, but it's just when. And of course, places like Asia and Europe and North America might have been affected first, but unfortunately the Southern Hemisphere is getting this in spades, and very warm climates like in India or the Middle East or Brazil and the other Latin countries in South America are being heavily affected by coronavirus at this time. And summer or heat do not offer protection, unfortunately, against COVID-19. Another summer activity, of course, is the swimming pool or hot tub, or getting out into other bodies of water. And we talked about this last time, that there's no evidence that COVID-19 can be spread to humans through the use of pools or hot tubs. And if you can just maintain your pools properly, this is an enviably beautiful crystal blue pool. And that's not easy to do, but when you do it, you should be able to get rid of your viruses and other things. And water supplies like our municipal drinking water are quite safe and will get rid of your virus. Well, what about open water, lakes, or seawater? What about a public pool or hot tub? I saw on a news feed on the weekend that there were kids starting to get into the community pools, which is wonderful, especially when the water gets this warm, or where the weather gets this warm. And again, immunologists are quoted to say we can get rid of the virus fairly quickly. And even if you had somebody sick that got into a pool or a large freshwater body, then gosh, that amount of virus will be so dilute that it won't be a problem. The big issue is not the water, it's not the pool, it's the proximity of people. And of course, this image of a hot tub spa maybe speaks to friendlier times when people could actually snuggle up close to each other. This is the kind of activity that's probably not the best activity during times of pandemic, unfortunately. The close proximity then brings us to the notion of masks. And why has the guidance on wearing face masks changed so much? Why is there so much news about this right now? Well, if we look at the Canadian guidance, I would say that the guidance in Canada really hasn't changed. We don't have crazy headlines in Canada about debates about masks and things like that. When I did look at the Government of Canada website just to get ready for this session, I saw that on June the 24th that it was updated. Here's the quote from the website, that wearing a homemade non-medical mask or a face covering is recommended when you're getting close up to other people within a 2-meter physical distance, and in other crowded public settings such as stores, shopping areas, or public transportation. And I guess we've seen that evolve over the last few weeks. And as people are getting back to work and onto buses and trains and streetcars and subways, that wearing masks would be a pretty common activity on public transport. In stores, from what I can see personally, it's kind of a 50-50, isn't it? But I think what Health Canada is suggesting is that, maybe we should make this more of a norm in the stores and shopping areas. And as one of my infectious disease colleagues reminds me, think of the mask as a sign of respect for others, that you care enough about other people that you're going to wear a mask to protect them. And I like that thought. And that's what I do, putting on a mask, even going into a shop or a store where it might seem that you're a bit out of place, but this is the sign of respect. And here's a couple of infographics from the Government of Canada website about do's and don'ts of wearing masks. And perhaps our hesitation from a few months ago about recommending masks universally was that there were a lot of problems with wearing masks, and there's still lots of things that come up. And when you see actually people wearing masks in public, gosh, you see lots of this thing going on, like people touching their masks or wearing it around their neck, or showing their nose over and above their mask. And that's the more common thing that I actually see, which would say probably this mask isn't doing any good and may not be as good as just keeping your distance and washing your hands. But now, as a sign of respect for others, do your part, wear your mask. But if you're going to wear your mask, do it properly and follow these kinds of guidelines, like checking out your mask and make sure it doesn't have holes or tears in it. Wash your hands before or after putting on your mask, or wash your hands before you put on your mask. Take your mask off, then wash your hands again. Don't expose your nose or any other parts. Make sure your mask is covering everything that you need. If you have a cloth mask, you can reuse it, but if it's a disposable mask, then get rid of it. In between, store it in a clean item like a paper bag until you wear it again. And then Health Canada will advise us, remember, wearing a non-medical mask or a face covering alone will not prevent the spread of COVID-19. The other things that you must do: wash your hands, keep your distance, stay home if you are sick. And for people that are in our workplaces, then we're still encouraging at this time to work from home wherever possible, just to minimize the amount of traffic that's out there. Now, elsewhere in the world, masks seem to be a much bigger issue. And for our friends, neighbors south of the border, this headline from today's edition of The Guardian, a UK paper, said, "How did face masks become a political issue in America?" They're just pieces of cloth, but a passionate portion of the US population sees the advice about wearing masks an attack on individual freedom. And it may be wrapped up in all kinds of other sorts of guidances, policies, and this has led to a real public health mess. I think we would all agree. Well, this is very important because of things like this, the epidemiology of coronavirus in Florida. And what we've observed from a distance is that, epidemiology says case counts in Florida and about half of the states in the US have indeed risen to record levels. And this is leading kind of new guidances in the state of Florida, like Miami and Fort Lauderdale beaches, will be closed for the next weekend amid coronavirus concerns. It says that as well as closing a beach or closing a bar, if you're living in Texas, that we have to be thoughtful about other public health measures that are put into place. And it seems that in the US, there really hasn't been really clear guidance, but there is more convergence on guiding people to wear face masks. So why different? In the beginning of March, what this CNN article points to is that scientists didn't know how easily the new virus spread between people without symptoms, the so-called asymptomatic carriers. They didn't know that infectious particles might actually hang around in the air for a few minutes. And at the beginning, it wasn't clear what the supply of personal protective equipment might be. And there was a desire, a hope, a wish to preserve certainly medical N95s and surgical face masks for use in healthcare facilities. Of course, since then, there has been kind of shoring up of the supply chain. There's been ample production of non-medical masks out there. And organizations like the Center for Disease Control and the US Surgeon General are now saying that they've changed the recommendations, and they are in fact urging the widespread use of face masks. And the CDC says, cover your mouth and nose with a cloth face cover when around others. And everybody should wear one when you go out in public to the grocery store or to pick up necessities. So in fact, there's a lot of consistency between what the US authorities like the CDC would say, as well as the government of Canada and the Public Health Agency of Canada. Where it gets kind of murky is what politicians might be saying, but scientists have been pretty consistent. Again, they're saying that COVID-19 is easy to spread just by talking or breathing. And without mitigation strategies like washing your hands, staying 6 feet apart, without wearing a mask, each person with coronavirus would infect 2 to 3 other people. And this is much worse than it is with the flu. And because the virus can incubate for such a long period of time, it gives this long window for people to infect others even before they know they're infected. And you may be infectious even before you get any symptoms. For all of these reasons, that protecting everybody, each other, with a face covering, a non-medical mask, is the way to go so that we can really reduce transmission. The science of this has been looked at as well, and this recent publication in the journal The Lancet, remember The Lancet, that British journal? Well, they've published a whole series of things rapidly around COVID-19. And this article I thought was very useful in case anyone asks, well, what is the evidence? Or people that ask on the other side, there is no evidence. Well, here is a very nice summary of the medical literature that was reviewed. And this term called meta-analysis means you join a number of studies together to try to arrive at some estimates of how important is this, or what are the chances. So for physical distancing, because we've heard this message over and over again, stay 6 feet apart. What's the magic of 6 feet apart? Well, here, it's really a continuum. The farther away you are from somebody, the lower your chance of picking up coronavirus. The chance of transmission at a distance of less than 1 meter was 12.8% when they analyzed a number of studies where there was viral transmission going on. And the chance of transmission falls from 12.8% down to 2.6%, so drops by a factor of 6 if you distance more than 1 meter. And if you stay actually 6 feet apart, it'll be even less than the 2.6%. So there's a dramatic drop off in the risk of transmission just by staying apart. People that look at this kind of information would say, whoa, if you even increase the distances, that might be even better. And some of my colleagues in the US that are running cardiac rehab programs with people on site have kind of gone with this and said, we're going to try to keep people at least 12 feet apart under exercise conditions. And we'll return to that in just 1 second. On the notion of face masks, which is where we came to with this kind of discussion, well, the chance of transmission in studies without a face mask or a respirator was 17% if you were getting up close and personal with somebody that was carrying virus. And that fell to 3% when a mask was worn. And in terms of using eye protection, then if you are close up with somebody that has coronavirus, the chance of catching it if you're not wearing eye protection was 16%. And if you wore eye protection like a shield, visor, goggles, or glasses, this drops to 5.5%. And this is what informs our practices in hospital. As much as possible, we stay far apart from each other. We wear face masks. We wear eye protection as our norm, because if you do all of those things, then you can really dramatically reduce the risk of transmission by doing so. So that's nice. That's a great medical update on what's going on. And here was a thought that came up around putting masks in the microwave to disinfect them. And here, a Yale School of Medicine professor says, that's not a great idea. We have no evidence of that. And if there's a piece of metal in the mask, whether it's an N95 or a surgical mask, or even some of the cloth masks that you might be able to buy online that have an adjustable nose clip, then there might be metal there and it'll blow up, says Dr. Vinetz. And cloth masks can simply be washed with soap and water and reused. And even disposable masks, if they're in really good shape, if you just let them sit for a few days, then they will, if there is any virus on them, they'll go away because they're known to live on hard surfaces for only up to 3 days or so. What about the notion of wearing masks while exercising? Well, the World Health Organization has looked at some data and they would say, well, if you're out and about and you're far apart from everybody else, then they would advise that people should not wear a mask when exercising, as masks may reduce the ability to breathe comfortably. Furthermore, if you're sweating a lot, that can make the mask become wet, which makes it difficult to breathe. And that might actually promote the growth of microorganisms. Not necessarily COVID, but bacteria. But if you have a wet mask, then it actually doesn't work that well at either protecting you from others or others from you. So they would say, if you want to exercise in an outdoor environment, as the cartoon kind of shows, then the very best strategy is to stay far apart from each other. And if there's a group of runners or a group of cyclists, make sure especially that you're maintaining some distance from each other. Is there any science to this? And I think this is interesting, that there was this article that was just published last week around research indicating the gym environments, that they pose no additional risk of catching COVID-19. And it's important to get some information as quickly as possible. So this was a study that was done in Norway from the University of Oslo that suggested that there was no threat of increased COVID-19 spread at fitness facilities, even when intensive training would take place, as long as a few very sensible things were done, such as preventative measures, such as social distancing in the gym. That means that there's only a few people in the gym at a time. There's scheduling, there's physical distancing apart, there's very good attention to hand washing and cleaning. And when people are actually working out, they were at least 1 meter apart, and preferably 2 meters apart if they were getting into activities where you're starting to breathe harder and exchange more air, and everything was cleaned up very meticulously. Furthermore, in the gym environment, locker rooms were open, but the showers and the saunas, those things were closed off. And what they said that was actually very consistent with what the WHO indicated is that for people exercising themselves, they were not required to wear masks. Staff members were, and of course, there would be very important attention to make sure if anybody was feeling sick, that they weren't going to come to the gym. There was screening for symptoms at the front door as well. So if we're very careful with all of these things, then we might be able to start to return to usual activities. And indeed, that's what they looked at in Norway. This was a cartoon graphic that the study team developed and posted up. So they compared almost 4,000 people and randomly assigned half of them to not do any exercise training, at least for the period of study, while the other 1,900 people were welcome to come to the gym starting in the third week of May. After a couple of weeks, everybody had testing for COVID-19 virus, and then they were watched to see what happened over the next 3 weeks. And what they actually reported, that in the group that did not do any exercise training, that is, they didn't come to the gym, there were 0 infections that occurred in that period of time. For those who were actually invited to come into the gym, there was actually 1 infection that occurred in that whole group of 1,896. But when they asked that person what was going on, they actually found that that 1 positive test occurred in somebody that had actually never been to the gym. They were intending to come to the gym, but they actually never arrived. And when they did this, the COVID testing, they picked it up. So it's one really cannot attribute the gym environment as causing that infection. It was probably picked up somewhere else with friends, family, public transport, restaurant, wherever it might be. So the investigators thought that this was a reasonable reassurance for at least the phase 1 of opening of public spaces like gym environments. And indeed, there are a number of gyms at the very early stages of opening where if you do all of these things that are described in preventative measurements, then that gives us some confidence that we can move ahead in a slow, gradual, careful way. And indeed, all of our hospital, clinics, and facilities like cardiac rehab, this is what we will be doing very, very carefully. And I'm pleased to report to you that as of today, June the 29th, we started our first activities with stress testing on site at the Rumsey Center. And we're doing all of these things very, very carefully. We're going to see a total of 5 people today. So really spread them out and be very, very careful with all of these measurements. Okay, so then one final thought around masks that's actually out there. And I gather that there's websites that are being devoted to the hazards of masks. There are Facebook posts of different sorts, and the WHO saw this going on and thought they actually had to post something up about this. The prolonged use of medical masks can be uncomfortable, but it doesn't cause you harm. People have been writing that if you wear a mask a long time, that's going to poison you with carbon dioxide or deprive you dangerously of oxygen. Well, it's just not true. And of course, we've known about this in hospitals for a century, right? Or more. And you would never expect your surgical team to do an operation without wearing a mask in order to protect you. You would not expect your surgical team to put themselves at risk of CO2 intoxication or oxygen deficiency. They couldn't do your operation in those circumstances. So this is clearly a myth that needs to be busted. Masks are safe. They can be well worn. It is true. They may be uncomfortable and they may be challenging for some individuals, in which case, please do the others kind of preventative measures. Distance yourself socially, stay out of crowds, stay at home, and use the mask only when you need to. They will be safe and they'll provide protection for you and those around you. Okay, finally, on the note of vaccines, which is the other really exciting part, when we looked at this back in May, we said there was a race on. There was no proven vaccine at that point on May the 12th, but there were many, many vaccines that were being explored. Where are we on June the 29th? So 6 weeks later. Well, it's still kind of has the same flavor. There's no single vaccine that's been proven and tested and available yet. There's many important vaccines that are being looked at. And when I looked at the World Health Organization website just this morning, it cites a document like this that says there are many candidate vaccines, 17 of them in clinical evaluation. So you could see that the funnel is getting narrower, which means a very good thing, that we're starting to look at interventions that make a whole lot more sense. News article from yesterday morning from CTV says this summer is going to be the important time in looking at what works in vaccines versus what doesn't. And of course, we all agree that the summer is the very important time so that we might get ready for the fall or winter round of virus pickup again. So it looks like people on 6 continents are quote, getting ready for jabs in the arm as the race for a COVID-19 vaccine enters a defining summer. There's research groups from all over the world, including the UK and China and the US, that are barely getting close. And what they are doing is actually testing the potential vaccines, not necessarily in the regions where they live, but in regions where there is kind of uncontrolled virus infections going on. So the UK team and the Chinese team might be looking at testing vaccines in Brazil and the United Arab Emirates. The US is set to open one of the biggest trials of 30,000 people, and the Brits will be doing another big study with 30,000 people, and we hope that they will lead to really good things going on. What kinds of vaccines? So it's not just one thing, that the idea is that if you can get your body to fight off an infection in some way, then that's the goal of vaccination. But the vaccine itself may be introduced into a body to protect it through different ways. So for instance, China is looking at inactivated vaccines. That is, you take a whole coronavirus intact, kill it by heating or boiling or cooking it. So then the remaining particles look like a virus. And then you grow a system that looks at that entire virus, and then if you inject that into a human being, it won't give you coronavirus, but it'll give you your own immune response against the whole virus. This is the way that a vaccine against polio or some flu, that's the way that they are made. So that's type number 1. Type number 2 is not looking at the entire coronavirus, but rather a key piece of it. And you may have heard this term called spike protein. You know, in the cartoons of coronavirus, when you see that nubbly head sticking out, that's the corona part of it, the crown. And that's the part where if you can just look at that as a target for a vaccine, then that might allow the human body to then neutralize anything that comes into the body subsequently that looks like that coronavirus. And at the University of Oxford, what they're doing is taking a cold virus, a virus that causes the cold, in a related kind of species like a chimpanzee, and looking for that spike protein to trick the human body to say, look, it looks like coronavirus is coming, develop your own immune response, so that it's almost like you develop your own army that will be ready in case any new coronavirus is coming in. And then other ways of looking at this are being looked at in the United States by institutes like the NIH. So there are a number of different pathways towards developing the virus vaccine. Dr. Fauci, who is famous as the important medical lead in the United States, is hopeful but cautious and even a little pessimistic. He is hoping that there will be a COVID-19 vaccine that will be available in the next several months. But in order for this to work, he cautions that a lot of people will need to take it. And that combined with a lot of people getting infected to build in a background immunity, those two things are going to be the important recipe parts to ensure the population will be well protected. That so-called herd immunity that we may have talked about in previous meetings. So if those things don't happen, then there's still going to be a large segment of the population at risk. So personally, I'm looking forward to vaccine development and hopefully its success. When it gets introduced, then this will be something that I think will need to be encouraging in the medical environment, certainly with working with populations who may be at risk. All right, well, that was an interesting discussion. I hope you found. I've enjoyed sharing some of this information with you. And I'm going to turn to the Q&A right now to see what sorts of issues that you might have in mind. And number one question was around a mask. Should I keep my mask on when I'm getting massage therapy? And the short answer to that one is yes. And indeed, speaking with colleagues that are in the massage industry, that is the advice that they are also receiving from their college of practice. So the mask is worn by the practitioner. It should also be worn by the client because of a couple of things that I'm sure you can answer now. One, are you close to each other? And the answer is yes, you're within 3 feet of each other. It's hard to do the massage at a distance. Number two, that is also very important, is the duration of contact. You know, typically you're going to be in close quarters for 30 minutes at least, and maybe as long as 90 minutes. So in that period of time, you are really breathing the same air. So wearing a mask is going to be important for both of you. Okay, number two question. What are the benefits of the plastic shields that are worn over the face? And the shield offers that second level of protection to the person wearing the shield in particular. That is, the eyes are a potential entry point for virus. So wearing some kind of eye protection, either in the form of a full face shield or goggles or glasses. The one study that we looked at showed that there was actually protection and reduced the amount of viral transmission substantially by doing so. So if you were getting into a close environment with somebody else that you couldn't avoid and you didn't know what their virus status would be, then wearing the mask and actually protecting your eyes would be a good idea. And that's what our clinical teams will be doing here. Also, that's what our research teams will also be doing when they're getting up particularly close to other individuals. And then another comment about the gym environment study showed that no one with the virus, or the gym environment study showed no one with virus, and that is an important factor. If no one has the virus, then there will be no transmission. It does not test that the virus were to be introduced into that environment. And that's a great point that certainly if we're somewhere where there's no virus, then we don't have to worry. But we're going to be in the environment where there might be virus going on. And you know, I think you're right that if we're as careful as possible about screening out people on our staff, as well as screening out clients as to our best ability, then that will reduce the likelihood. But we also need to be aware that somebody might walk in with virus. And if that's true, then we need to have in play as many of the safety measures as possible in order to protect everybody. And this is the case of why we need to think about distancing and masking and washing our hands, etc. You know, there are some bad stories that we've seen that have occurred over the weekend, like the nail salon, where you know, a cluster of infections becomes rampant when all of those important preventive measures are not respected. You know, the flip of that is that there have been occasions where there has been someone positive in the nail environment situation elsewhere in the United States, for instance, and there was no transmission of virus because everybody was wearing masks and washing hands and doing all the good infection control. So it can make a difference. We might be concerned about the environments that we get into, and I think that's just going to be our normal our normal way of operating going forward. Okay, I think those are all the questions for today. I thank you for those items, and I'm just going to move on to the announcements for the next session. Tomorrow at 1 o'clock will be our regularly scheduled walk and talk with Rob, and I'm sure he's got some great things in store for you for not only the kitchen exercise, but also a thoughtful topic to jump into. And we'll also remind you on Canada Day, July the 1st, that there will not be an online cardiac college session for this week. On the Wednesday, we wish you a very happy Canada Day. As always, we wish you good heart health. Thank you for joining us for this session. Have an excellent Monday.